Hello, everyone. My name is Tori Keaton, and I'm the Policy and Government Affairs Manager at the NC Rural Center. Thank you for joining me for this recap of the 2022 legislative session. The legislature adjourned on July 1st after completing most of its business for this year. However, it's important to note short session isn't quite over yet, as the adjournment resolution passed allows for the legislature to reconvene monthly through the end of the calendar year to work on some remaining points of business. That being said, throughout this presentation, we will cover the legislation and budget line items moved so far that relate to our 2022 Rural Counts advocacy priorities. Each year, through extensive research and ongoing conversations with people working and living in rural North Carolina, we update this list of 5 policy areas that influence our rural economies. This includes broadband, health, housing, water and wastewater, and small business. To start off, we will go over Medicaid expansion. This is a topic that has been heavily reported on this session and refers to expanding Medicaid coverage eligibility to those with incomes up to 133% of the federal poverty line. This would close what's called the health insurance coverage gap in North Carolina. People who fall into the coverage gap are currently individuals who make too much to qualify for Medicaid, but too little to qualify for a subsidy on the marketplace. The Rural Center is supportive of this move, as a disproportionate share of those who fall into the coverage gap in North Carolina live in rural areas. This session, we were very pleased to see support to close the health insurance coverage gap grow significantly amongst leadership in both chambers. Jones Street was watched closely, even in the very hours leading up to adjournment, to see if the House and Senate could come to an agreement on a measure to close the health insurance coverage gap. That's because earlier this session, both chambers introduced their own proposals that included mechanisms to close the health insurance coverage gap in North Carolina. The Senate's version was first to surface. The bill closed the coverage gap and included other provisions that are subject to fierce contention. This included certificate of need reform, requirements for commercial health insurers to cover telehealth in limited circumstances, as well as a measure that granted full practice authority to advanced practice nurse practitioners, otherwise known as the SAVE Act. The House responded with a far more narrow bill that didn't directly expand Medicaid, but instead ordered the Department of Health and Human Services to create a plan to expand Medicaid that the legislature would consider this December. The plan would also have included changes to hospital financing, funding to address the opioid, substance abuse, and mental health crisis in North Carolina, as well as measures to address access to care issues in rural parts of the state. As of the recording of this presentation, House and Senate leadership have not been able to come to an agreement. However, the adjournment resolution creates space for the legislature to reconvene periodically throughout the rest of the year, and therefore the matter can still be readdressed before the end of session. However, the legislature was able to attend to other health policy matters. The budget, signed into law by the governor on July 11th, includes multiple lines of funding related to rural health. This includes a boost in recurring funding to the Rural Health Loan Assistance Repayment Program, specifically to recruit and retain primary care providers in the state. This, of course, is a very important program that uses loan repayment as an incentive to attract providers to practice in rural areas experiencing provider shortages. The budget also allocated $1.3 million in recurring funding for the 988 crisis helpline. This helpline was recently implemented nationwide as a 3-digit number similar to 911 to replace the old 1-800 suicide prevention hotline. Also of note, the budget will merge the NC Health Choice Program and Medicaid together. Previously, children at different percentages of the federal poverty level eligible for public health insurance coverage were covered by separate programming. Now, NC Health Choice will merge into Medicaid, allowing for less administrative burden and more robust coverage for these children. Beyond the budget, the legislature took a look at a few standalone bills. The Licensed Counselors Compact passed, adding North Carolina to a list of states that joined a compact and thus recognized the license of counselors licensed by the other states within the compact, allowing them to practice within North Carolina with an out-of-state license. More states need to join the compact for it to go into effect, but once it is, this will help counselors practice across state lines and hopefully help move against the severe provider shortage we see in mental health care treatment. Another bill looking at creating better access to care was S 345. This would have allowed certain physician assistants in team-based settings to practice without the supervision of a physician. However, this bill ended up stalling in the House. Moving on from health policy and considering small business, the Rural Center advocates for small businesses through our North Carolina's new small business plan. This set of policy recommendations was put together by a group of advocates, researchers, and small business owners to consider the most pressing matters affecting our small businesses. The legislature addressed a few of these issues, including in the budget, by creating $2.8 million in recurring funding to expand the capacity and sustainability of the Small Business Center network. These centers are housed at community colleges throughout the state and provide technical and expert resources to small business owners to help establish and grow their business. With small businesses booming this year and trends continuing upwards, this funding is greatly needed for the centers to service significant increases in demand. The budget also allocated funds to help modernize and support career and technical education programs, or CTE programs. CTE programs are a commendable resource for students across the state, empowering them with real-world skills and practical knowledge, preparing them to be engaged members of their communities and hometowns. Other bills this session included a bill to increase the Jobs Development Investment Grant, or JDIG award, for businesses relocating to Tier 1 or 2 areas, incentivizing businesses to create jobs and opportunities in areas with the greatest need. This bill passed and is now signed into law. However, a bill that was only introduced was 783. This bill would have established a study committee to consider the implementation of a short-term compensation program. These programs, also known as work-share programs, create an alternative for employers to layoffs during times of economic downturn by instead reducing hours across staff and allowing staff to collect unemployment benefits proportional to the wages that they lost. The program creates a win-win for both employers and employees. Employers keep their skilled workforce and employees remain employed in the workforce. This is something included in our new small business plan, so we will be keeping an eye on it during future sessions moving forward. Moving on to broadband. Last year, we saw huge investments made into broadband and more is coming down the pipeline through the Federal Infrastructure Investment and Jobs Act. You can tell this budget was preparing for that by including a provision that made plans to split the federal funds accordingly for a variety of programs administered by the state that work to increase access to broadband. The budget also made room for wireless providers to participate in the GREAT program, which is one of these existing grant programs that works to increase access to broadband in rural areas of the state. And finally, H 1133 was a bill that was introduced but not passed that looked at modernizing the definition of broadband by considering what speeds were available in what we consider as served, unserved, and underserved areas. This is bringing up the fact that we want to make sure that when an area is being considered served or having access to broadband, that the broadband that they have access to can truly meet modern needs and requirements. Thinking about housing now, a substantial infusion of funding was made into various funds and programming looking at affordable housing. The Housing Trust Fund got a one-time appropriation of $10 million. This trust fund is of particular importance because it is the state's most flexible pot of funding to address housing needs. The Workforce Housing Loan Program got a one-time boost in funding to assist with the development of multifamily affordable housing units across the state. And the Low-Income Household Energy Assistance Program received recurring funding lines. This is a program that deserves far more attention than it gets. What it does is help qualifying North Carolinians that need assistance paying for their heating bills. It also has a variety of sub-programming that looks at the weatherization of housing, repair and replacement of HVAC units, and crisis services that help households with heating and cooling needs in times of crisis. And lastly, we'll finally look at water and wastewater. You'll see multiple lines of funding here, including about $611 million in non-recurring funds for water and sewer infrastructure grants. About $412 million of this has already been reserved for specific projects in various counties and municipalities, so it leaves about a third unreserved. Additionally, $120 million in non-recurring funding has been appropriated for the Clean and Drinking Water State Revolving Funds. These revolving fund lines are reserved for projects pertaining to water quality, and a portion of the 2022 allocation are reserved for grants for small and disadvantaged communities. And finally, another $111.6 million of non-recurring funding was appropriated specifically to look at addressing emerging compounds and lead being detected in some of our North Carolina water systems. And that is a summary of the major movement we've seen in legislative items and budget lines affecting rural North Carolina so far this year. We include all of that information and more in our written 2022 end of session recap that I encourage you to check out. It's available for download on our website. And of course, I would also like to encourage you to connect with us through a multitude of ways. You can join our North Carolina Small Business Coalition and show your support for our state's entrepreneurs and receive special newsletters with updates pertaining to small businesses in North Carolina. You can also sign up for the Rural Counts Advocacy Network to receive newsletters, action alerts, and exclusive webinars to keep up with the advocacy work of the Rural Center, and subscribe to the Rural Center's main newsletter to learn about trainings, engagement, and leadership opportunities and all things rural happening in North Carolina. And with that, on behalf of all of us at the Rural Center, I thank you for tuning in and your continued support of rural North Carolina.